Welcome to Understanding How to Regulate Self-Care During Clinical Practice. My name is Tamara Hunt, and I'm an associate professor in the Department of Health Sciences and Kinesiology at Georgia Southern University. This webinar is a part of a set of professional development webinars developed by the National Youth Advocacy and Resilience Cooperative, supported by the National Youth Advocacy and Resilience Research Center at Georgia Southern University. Attention deficit trait is a condition of feeling constantly overwhelmed as a result of being bombarded by too much information and too many demands that require us to engage in simultaneous thinking tasks. For example, if we are writing emails while talking to somebody on the phone, while trying to remember what we need to do to organize a meeting, which I'm sure we've all done, we start feeling overwhelmed. This can cause great anxiety and lead to attention deficit trait, which is not to be confused with attention deficit disorder. Attention deficit disorder, or ADD, is a psychological disorder, a combination of environmental and psychological factors. But attention deficit trait is purely environmental. It's just being bombarded with too much information, and it impairs our critical thinking. Many clinicians have this attention deficit trait because we try to do too much at once. Clinicians give of themselves and rarely preserve time for themselves. The number one complaint is often, "I'm tired and burnt out, but I don't have any time to do anything about it." Hopefully, this webinar will provide a basic introduction on how to include self-care into a busy clinical practice. But first, we must start with what you're already doing well by completing the mindfulness questionnaire. You have to understand what you already do and how you implement it more thoroughly, effectively, efficiently to mitigate the stress, emotions, and sensations that occur daily and in your clinical practice. So, as time is of the essence, I preface this webinar with 5 clinical pearls to incorporate self-care into clinical practice. First, we're going to start with personal reflection. What do you do well? When you look at all the things that you're responsible for or just have to do, many of us ask, is it really realistic? We have so many pressures and demands on our time that you might lose yourself in the moment. Working with coaches, parents, athletes, and students' expectations can be difficult. Are there expectations that you would be available to them all the time, at any moment? Is that realistic? And then you add in decreased wages, economic instability in the current climate, clinicians and faculty leaving the profession, increasing workload, and finally, the complexity of medical concerns, including COVID-19, and the difficulties of the rising mental health challenges are creating an environment that can be overwhelming. We have to manage the expectations of others, and especially ourselves, to ensure that we take care of our own well-being. But how do we do this? You have to know thyself and know thy strengths. Within this file, you can find the mindfulness questionnaire. This questionnaire is designed to access how often you are using mindfulness practice in your daily life. When you take the questionnaire, base your answers on what really happened and on actual experiences rather than what you think it should be. The mindfulness questionnaire will allow you to understand what you do well already, and you can lean into that, or what you would like to improve on a given area within this. Once you complete this, you're then going to reflect on your answer. Celebrate the things that you're doing really well and look at the items that you can improve upon and work on those slowly with the time that you have available. You don't just need to add another thing to your plate. This mindfulness questionnaire can be found at the attached link on this slide. So now we move into the next item of grounding yourself. Oftentimes, when we're in the hustle and bustle of clinical practice, we're trying to squeeze in one more patient, one more student, one more meeting, but every encounter can be stressful. And if that stress builds, it can become overwhelming and leave you with very little energy, passion, or enthusiasm for the next patient, student, or even yourself. So, in between patients, students, or meetings, stop. Put your hand on the door, a table, a chair, a wall, or anything you can to just center yourself. Then take a deep breath. Placing your hand on something firm allows you to focus and ground yourself in that moment. This will help you reset and quiet the bustle around you. This also allows you to quiet the noise and limit those external stresses that you have. You may need to take several deep breaths to truly reset, but this can be accomplished in a very short period of time. Grounding oneself also stops us from going into default or autopilot. Sometimes when we're in default mode, we may end up beating ourselves up, focusing on the things that went wrong or on the things that we failed to achieve. We have our limits as human beings. If we're compassionate toward ourselves, we'll be more accepting of other people. If we're always negative and overcritical of ourselves or of others, this mindset becomes a habit. We become better at being critical by practicing it, and thus negativity becomes a skill that we acquire. While focusing on grounding ourselves and focusing on compassion and positivity, we can be better people for ourselves, our patients, our students, and our community. Do you feel refreshed? Did you try it? Can you give yourself some compassion and take some deep breaths? I hope so, because that brings us to the next pearl of wisdom, making the time. The number one reason people say they can't do something is they don't have time to do it. We often discuss feelings of being overwhelmed and stressed. However, I believe we can make the time to do the things we want to do, and further, practice makes perfect. However, when you're in the middle of a hectic time or busy clinical and teaching schedule, it's hard to think of what you can do in the limited amount of time that you have to spare. So I challenge you to complete this self-care plan before you get into that stressful situation. Giving that time is often the limiting factor. Think through what strategies may work for you when you have a whole day for self-care. What would you do to refill your cup? What support or resources would you need? And then work your way all the way down from half a day, 1 hour, 30 minutes, 1 minute. See what you can come up with. By focusing on the little things, we can foster positive energy. We become grateful for what we have, positive, and kind to ourselves and others. It also reinforces our decisions to practice self-care and improve our overall well-being and ability to support our students, patients, and colleagues. So, you found the time. Now, we're going to make a plan. Within the mindfulness personal development plan, you're going to identify how mindfulness as a technique can support self-care and can help yourself. You're going to talk about what kind of mindfulness techniques you can do. And then the plan will allow you to practice the specific activities and identify which ones you prefer. And then at some point, you're going to circle back around to reflect on how this is working. Are you handling stress better after practicing some of these techniques? Part one of the mindfulness personal development plan focuses on what you do well and areas that you can improve. For those in administration, this is your mindfulness SWOT analysis. However, in part two, this is your goal setting. We know that when we establish that we don't have time for things, we push them to the bottom of our list. But if I can attach SMART goals to these items, I'm going to work to achieve them. So the goal of this part two is to really sit down and say, what are your goals moving forward to incorporate mindfulness techniques, if possible, into your clinical practice? So we've talked about personal reflection, grounding oneself, making the time, and making a plan. And now it's time for us to practice. I'm going to provide a few techniques that you can do in a short, hopefully efficient and effective time period. First, we start with breathing meditation. Mindfulness is about practice to become better at things that mindfulness promotes. We have talked about the importance of everyday activities that often get little attention. This exercise is going to focus on what we do most often than anything else without noticing, breathing. By focusing on our mind, on our breath, we rediscover with new eyes using the power of curiosity, one of our most basic functions. For this activity, you can read through a script or you can just do a short guided meditation. The next thing is we can focus on the present. As we are in a society that is consistently moving, distracted by different stimuli, all competing for our attention, dealing with too many stimuli at the same time can be quite stressful. Focusing on the present brings us back to concentrate on what is important at any given moment and helps you focus on what is rather than what if situations. Being able to focus on the present allows us to focus on what is rather than what if scenarios. Often we worry too much about things that might or might not happen, things which are not real. When this happens, it is useful to focus on the present in order to stop worrying needlessly. If we just worry about things that might happen, we can feel overwhelmed and stressed unnecessarily. On the contrary, focusing on what is can help us make plans with a clear mind. We are aware of possible threats and opportunities, and we decide to plan for any event. Planning for the future makes you feel calm and in control. Learning from the past is different from reliving the past and regretting what you did or didn't do. Remembering the past and learn from it, that's constructive. Reliving the past and worrying about what you did or didn't do can only make you feel stressed, as it evokes bad emotions without being able to do anything about it, what has already happened. The next activity we can do is the 5 senses activity. This is a quick meditation activity. For this exercise, you will sit comfortably and focus on one sense in turn. For senses that do not involve sight, feel free to close your eyes if it helps you focus. First, you want to notice 5 things you can see. Look around you and notice 5 things that you would not normally see. For instance, a shadow, a crack on the ceiling, a spot on the wall. Then you're going to move to notice 4 things that you can feel with touch. For example, the texture of your clothes, the air on your skin, the surface on the table. You're going to then move to noticing 3 things that you can hear, such as background noises, birds singing, car engines in the distance, the TV or computer. You're going to then turn to notice 2 things that you can smell, either pleasant or unpleasant. These can be the smell of food, new plastic, perfume, flowers. And finally, you're going to notice 1 thing you can taste. You can eat a bite of food or sweet, take a sip of something to drink, even if it's water, or just feel the taste that's in your mouth right now. Then you're going to bring yourself back to attention and back to center. Take a deep breath and continue with your next activity. The next activity in this webinar focuses on detachment and letting go. Detachment does not mean being selfish or not caring. It does not mean to avoid reality. If anything, by practicing focus, mindfulness encourages you to get in touch with reality. What detachment does mean is to let go of ideas, objects, people that make us suffer or do not let us see other perspectives or other points of view. Sometimes we get too distracted or too attached to judgments, preconceptions, or anything that stops us from expanding our horizon. One of the purposes of mindfulness is allowing us to let go while being aware. We are aware that something exists, a feeling, for instance, and we're not critical of it, but we decide to let it go. If you're trying to focus and other thoughts or emotions come to mind, don't suppress them, acknowledge them, but then let them go. strategy you can use is the stop sign technique. If you've had a really stressful day in the clinic, on your way home, identify a place and time. This can be a stop light at a certain intersection that you go through, or even a stop sign. And then you're going to make a deal with yourself that at that stop sign or that stop light, you are going to leave all the worry, anxiety, stress from work and let it go. You are not going to take that home. Detach and let go. Now that we've reviewed these 5 pearls of wisdom, I'm going to leave you with some self-care tips. In the morning, when you get up, take time to be awake. First, remember that self-care, such as mindfulness practice, doesn't have to take long, and some can even be completed in 5 minutes or less. But if you can, in the morning, when you get up, take time to be aware of your breathing. How does your body feel? Take notice. Put yourself in the present moment. During the day, take an opportunity to practice paying attention to the feelings in your body and or the things around you. Notice your posture as you sit or as you stand. Make a mental list of things that you're grateful for in your life. Again, if you focus on the good gets better. And then before falling asleep at night, do a quick body scan. Just check in with yourself. How are you doing? Just remember, if you can take 1 minute throughout your day to ground yourself and practice self-care, you can model these positive behaviors to your patients, your students, and your colleagues, which is ultimately going to improve everybody's well-being. So I want to thank you for taking the time to listen to this webinar. Please feel free to email me if you have any questions at thunt@georgiasouthern.edu. We thank you for your time. If possible, we would love your feedback about the professional development opportunities. We hope that you are willing to complete this post-webinar survey that can be accessed via the link on the screen or the QR code on this slide. Thank you and have a great day.